the surgical management of inflammatory bowel disease. Welcome to today's episode, where we're taking a deep dive into the surgical management of inflammatory bowel disease, a subject that is essential for anyone dealing with Crohn's disease or ulcerative colitis, and for those supporting them on their health journey. Let's start by setting a critical foundation. Opting for surgery in the context of inflammatory bowel disease is not an admission of defeat or a sign that previous treatments have failed. Rather, surgery is a vital tool in the management of complications and in cases where the disease simply does not respond to medical therapy. What's important to understand is that the philosophy and approach to surgery can be very different between Crohn's disease and ulcerative colitis, reflecting the distinct ways these conditions affect the body. Now, let's talk through the overarching principles guiding surgery for these diseases. For Crohn's disease, surgery is not seen as a cure. The primary goal here is to address complications as they arise, while preserving as much of the bowel as possible. That's because Crohn's disease can recur anywhere in the digestive tract, and repeated operations can ultimately lead to a condition known as short bowel syndrome. In contrast, with ulcerative colitis, surgery can indeed be curative. This is due to the fact that ulcerative colitis is limited to the colon and rectum, and by removing these organs, the disease itself is removed. However, the decision to operate is never taken lightly. It involves input from a multidisciplinary team, including gastroenterologists, colorectal surgeons, specialist nurses, and most importantly, the patient. Timing of surgery is crucial and must be carefully considered. While both Crohn's disease and ulcerative colitis might require surgery for similar reasons, such as persistent disease, blockages, or fistulas, the specific procedures are tailored to the unique characteristics of each condition. Let's begin by exploring surgical options for Crohn's disease. The philosophy here is one of bowel preservation. The disease has a tendency to return, often in new areas, and so the aim is always to be as conservative as possible with the amount of bowel that is removed. Common reasons for surgery in Crohn's disease include disease that does not respond to medication, bowel obstruction caused by scar tissue or strictures, complex fistulas, for example, those connecting to the bladder or vagina, or causing persistent perianal disease, abscesses that cannot be drained through less invasive means, rare, but serious, free perforations of the bowel, uncontrolled bleeding, presence of cancer or pre-cancerous changes. Surgical techniques in Crohn's disease focus on preserving bowel length. Stricturoplasty is a key procedure, where the surgeon widens a narrowed section of bowel without removing it, ideal for patients with multiple short strictures, particularly in the small intestine. When removal is necessary, the operation is conservative, taking out only the diseased segment, such as a segmental resection or an ileocolic resection, which is most common in Crohn's disease. For severe Crohn's colitis, a protocolectomy may be necessary. In addition, managing perianal disease often requires a combination of medical and surgical strategies, including procedures under anesthesia, placing stenums for complex fistulas, or performing a fistulotomy for simple cases. Sometimes, a temporary or permanent stoma, either an ileostomy or colostomy, is created to divert the fecal stream and allow healing. Now, let's shift to ulcerative colitis. Surgery here is truly transformative and can be curative, as it involves removing the entirety of the colon and rectum. The most common indications for surgery include disease that cannot be controlled with medication, acute severe colitis that does not respond to 3 to 5 days of intensive therapy, detection of cancer or pre-cancerous changes during colonoscopy, toxic megacolon, which is a life-threatening emergency, delayed growth in children or systemic complications outside the colon, such as skin ulcers. The gold standard surgical approach for ulcerative colitis is a total proctocolectomy with ileal pouch anal anastomosis. In this multi-stage procedure, the colon and rectum are removed, and a new reservoir, commonly shaped like a J, is crafted from the small intestine and connected to the anal canal, thus preserving continence and normal defecation. The surgery is often staged, with either 2 or 3 operations depending on the patient's health and urgency of the situation. For some, particularly those who are not suitable candidates for the pouch procedure, perhaps due to poor sphincter function, advanced cancer, or personal preference, the entire colon, rectum, and anus are removed, and the end of the small intestine is brought to the surface as a permanent stoma, called an endoleostomy. This is a single, definitive operation, and while it means living with a stoma, it eliminates the risk of pouch-related complications. let's discuss some key considerations and potential complications. In Crohn's disease, the aim of surgery is control, not cure, and recurrence is unfortunately common. Clinical recurrence rates can be as high as 50 to 80% over 10 years, often at the site of the previous surgery. As such, ongoing medical therapy after surgery is usually recommended, especially for patients at high risk of recurrence. But, when surgery resolves issues like obstruction or fistulas, patients can see a dramatic improvement in quality of life. For ulcerative colitis, surgery offers a definitive cure. After a successful ileal pouch anal anastomosis, most patients retain continence and report excellent quality of life. However, complications can include inflammation of the new pouch, anastomotic leaks, pelvic infection, and in women, infertility due to pelvic scar tissue. To summarize, in Crohn's disease, surgery is a valuable tool for managing complications, with a conservative approach aimed at preserving as much bowel as possible, always with the understanding that disease may return. In ulcerative colitis, surgery provides a cure, with the choice of operation tailored to individual patient needs and circumstances. The decision for surgery is always nuanced, requiring careful consideration of the risks and benefits of ongoing medical therapy versus the potential for improved quality of life. And in the case of ulcerative colitis, a definitive cure. That brings us to the end of today's discussion. Remember, every patient's journey is unique, and the decision for surgery must always be personalized and made in partnership with a dedicated healthcare team. Thanks for tuning in. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.